Your surgeon will find the carotid artery and temporarily clamp off blood flow through it. Your surgeon will open up the artery and may place a shunt or temporary bypass to keep blood flowing to the brain. Your surgeon will then remove the plaque within the arterial walls. After the blockage has been removed, he or she will sew the artery back together, usually placing a patch to widen the artery slightly. The patch may be made of part of one of your veins or an artificial material such as Dacron.
In carotid angioplasty and stenting, a long hollow tube called a catheter is inserted in the femoral artery in the groin area. The catheter is then maneuvered through the arteries until it reaches the narrowing in the carotid artery in the neck. An umbrella-shaped filter is inserted beyond the narrowing to catch any plaque or debris that may break off during the procedure. Then a tiny balloon at the end of the catheter is inflated to push the plaque to the side and widen the vessel. A small metal coil called a stent is inserted into the vessel. The stent serves as a scaffold to help prevent the artery from narrowing again.
A vessel loop is placed to control and clamp the artery during the procedure, and a suture is placed for easy closure of the puncture site at the end of the case. A specialized sheath is placed through a small puncture in the common carotid artery. This sheath will be used to deliver a stent, but first it will temporarily reverse blood flow in the artery. Flow reversal keeps debris moving away from the brain, protecting it from dangerous emboli. The sheath is connected to a circuit outside the body that directs the blood flow into the femoral vein. The connection between the high-pressure arterial system in the brain and the low-pressure vein in the leg creates a pressure gradient, causing blood to move backwards in the carotid artery. With flow reversal established, the conformable en route transcarotid stent is placed to stabilize the plaque against the wall of the artery and minimize the potential for a future stroke. Balloon catheters can also be used to further expand the stent when appropriate. The delivery of these therapeutic devices can disrupt the plaque, causing dangerous debris to come loose. The en route transcarotid neuroprotection system is designed to capture and filter that debris throughout the procedure to prevent a procedural stroke. Once the stent is placed, the clamp is loosened and the sheath can be removed so that blood resumes its normal path to the brain.